A satellite technician trusted a robotic pharmacy kiosk and received a massive chemical error. The technician unknowingly ingested 5 milligrams of Amlodipine, a potent calcium channel blocker that prevents calcium ions from entering the smooth muscle cells of the arterial walls. A 45-year-old male, whom we will call Robert, arrived at the emergency department after a total syncopal collapse. Syncope, from the Greek syn meaning together, and koptein, to strike or cut off, is a sudden loss of consciousness. Robert had been working on a rooftop in 95-degree heat for 6 hours, performing heavy labor. This work already required his cardiovascular system to work at peak capacity. When he felt a wave of impending doom and a sudden darkening of his vision, he collapsed. On arrival, his blood pressure was a critical 70/40 millimeters of mercury. Usually, a patient in shock is cold and pale as the body pulls blood toward the core to survive. This is a survival mechanism called peripheral vasoconstriction. But Robert was different. His skin was dry, flushed, and strangely warm to the touch. This contradiction suggested his blood vessels were not constricting to save him. They were wide open, paralyzed in a state of total relaxation. This is the classic signature of distributive shock, a state where the volume of blood is normal, but the container holding it has suddenly become too large. His heart rate had climbed to 115 beats per minute, a compensatory tachycardia. Tachycardia is from tachus for swift and cardia for heart. His heart was racing to fill a vascular system that had completely lost its structural grip. The mystery was solved when his coworker handed over a prescription bottle retrieved from an automated kiosk. The label was for Amlodipine, a common medication for hypertension. While the label specified a standard 5 milligram dose, the robot had malfunctioned, dispensing 20 times the intended amount. Robert had unknowingly ingested 100 milligrams, a dose 5 times the known toxic threshold. This error was compounded by the rooftop heat, which had already caused mild dehydration. This left Robert with zero physiological reserve to fight the overdose. Amlodipine is a potent vasodilator, from the Latin vas, meaning vessel, and dilatare, to spread out. To understand why Robert's blood pressure refused to rise despite aggressive fluids, we must look at the microscopic gates governing his muscle contraction. Every artery in the human body is wrapped in a layer of smooth muscle that must maintain a constant state of partial contraction, known as vascular tone. Inside the smooth muscle cells of Robert's arteries, the high concentration of amlodipine slammed the L-type calcium channels shut. This created a failure of the calcium switch. Normally, calcium enters the cell and binds to calmodulin, from cal for calcium and modus for measure, which then activates an enzyme called myosin light chain kinase. Myosin, from the Greek mys for muscle, is the motor protein that pulls muscle fibers together to create tension. With the calcium gates jammed shut, the muscle fibers drifted apart like a frayed, loose rope. Robert's arteries became loose balloons, losing all elastic recoil. Imagine a high-pressure garden hose trying to reach a second-story window. If you suddenly replace that hose with one 10 times wider, the pressure vanishes and the water simply pools on the grass. Because of this massive vasodilation, Robert's heart, despite beating at a frantic pace, could no longer push blood upward against gravity to reach his brain. 6 hours after ingestion, the crisis entered a lethal spiral. As his mean arterial pressure dropped to 50 millimeters of mercury, his kidneys began to starve. A pressure below 65 triggers prerenal azotemia, from azo for nitrogen and amia for blood. This is a state where nitrogenous waste builds up because there is not enough pressure to push blood through the renal filters. The kidneys require a specific pressure gradient to function. Without it, they become stagnant pools of metabolic waste. Simultaneously, his precapillary sphincters failed. These are the tiny muscular rings that control blood flow into the smallest vessels. Their failure caused a lethal leak where fluid escaped from the bloodstream into the surrounding tissue, forming massive edema throughout his limbs. Robert entered a state of profound obtundation, from the Latin obtundere, meaning to beat against or dull. As blood flow to the brain plummeted, he became unresponsive to verbal commands. Because his diastolic pressure had cratered, the coronary arteries could not deliver oxygen to the heart muscle itself. This triggered myocardial ischemia, from isch for keep back and hema for blood, effectively starving the pump. The heart muscle began to suffer from the very lack of pressure it was trying to correct. Blood gas analysis revealed a plummeting pH and a lactate level 10 times the normal limit. This is lactic acidosis, a sign of anaerobic metabolism where cells deprived of oxygen delivery begin to ferment fuel just to survive. This process creates a toxic, acidic environment that further weakens the heart's ability to contract. This toxicity is notoriously treatment-resistant because the chemical off switch for the blood vessels is physically jammed by the massive dose of amlodipine. Standard medications like adrenaline often fail in these cases because the receptors they target are downstream from the broken calcium gates. To save him, the medical team initiated high-dose insulin therapy. While insulin is typically used to manage blood sugar, at doses 10 times higher than standard, it acts as a potent inotrope. The word comes from the Greek is for strength, and tropos for influence. This mechanism bypasses the jammed calcium channels. In a state of shock, the heart normally struggles to process fatty acids for fuel. High-dose insulin forces the heart to switch to glucose, which is a much more efficient fuel source during a crisis. This restores cardiac contractility. Contractility is the innate ability of the heart muscle to shorten and pump with force. The medical team also administered intravenous calcium gluconate, attempting to overcome the blockade through sheer concentration. They were essentially trying to flood the system with enough calcium to force the few remaining open channels to work overtime. Slowly, the mean arterial pressure stabilized above 65 millimeters of mercury as the pipes regained their grip. The transition was not immediate. It took nearly 24 hours of continuous infusion to counteract the long half-life of the medication. Robert eventually woke in the intensive care unit, surviving a 10 times lethal dose. The garden hose finally reached the second-story window. He remained in the hospital for 5 days as his kidney function slowly returned to baseline. The excess fluid in his tissues was reabsorbed into his circulation. Robert survived because the medical team recognized that his shock was not a lack of fluid, but a loss of vascular tone. This case highlights the Swiss cheese model of failure, where a robotic dispensing error, a lack of final pharmacist overread, and the physical stress of rooftop work aligned to bypass multiple safety checks. It serves as a reminder that even the most trusted automated systems require human vigilance. Always verify your medications and cross-reference the physical appearance of a pill with online databases, especially when they are dispensed by automation. Thank you for watching this breakdown of systemic collapse. This accidental overdose caused total systemic vasodilation, resulting in a refractory drop in blood pressure that the body could no longer compensate for through heart rate alone. This is a composite teaching case for curiosity and education, not a transcript from a real chart, and not personal medical advice. See a licensed clinician about your own symptoms or care.